Okay, question ko sa inyo. Is circumcision part of surgery? Surgery ba yung circumcision? Yes or no? Surgery ba yung ating circumcision? Yes or no? Yes, very good. Yes, part iyon ng ating operation, yung circumcision natin. Natanong ko sa inyo, kapag ba yung bata o yung bata, okay, hindi na matanda ha, kasi bata yung ating sinicircumcise, pero pwede din kapag matanda. Okay? Yung bata, ina-admit ba sa hospital? Yes or no? Hindi. Okay? Pwede siyang pwede siyang outpatient department. Pwede siyang OPD i-perform yung ating surgery. Very good. It's a minor surgery. So, ibig sabihin, pwede siya sa labas. Hindi siya i-admit. Now, question ko sa inyo, hindi naman na-admit yung pasyente. Saan magsisimula yung pre-operative phase? Anong phase, anong part, or ano yung clue natin para masabi natin, ay, start na ito ng pre-operative phase. Kapag, okay, listen carefully, kapag yung pasyente nag-contemplate, nag-isip na gusto niya magpa-opera, that's the time nagsa-start na po yung pre-operative phase. Okay? Like for example, gusto niyo mag-nose lift. Okay? Gusto niyo mag-nose lift or gusto niyo lumaki yung mga dede or puwet niyo. Okay, yan. Kapag gusto mo, nag-isip ka, that's already contemplating, that's already pre-operative phase. Okay? Lagi nating tatandaan, ito na lang, shortcut natin para hindi tayo ma-confuse. Kapag sinabi ko pong nag-isip tayo until the patient, okay, is hindi pa siya sa OR table. Okay, inag-transfer or let me say na siya ay papunta or endorse natin sa OR, that's already your pre-operative phase. Okay, very good. Now, proceed tayo on your intraoperative phase. Your intraoperative phase extends from the client is admitted to the OR. Yan, na-admit na siya sa OR. Nasa OR table na yung pasyente natin. To the time of administration of anesthesia, surgical procedure is done until he or she is transported to RRN PACO. Lahat na nangyayari sa loob ng OR, yan po ay intraoperative phase. Again, lahat po na nangyayari sa loob ng operating room is considered your intraoperative phase. Okay? Yung administration of anesthesia, yung procedure natin, like for example, appendectomy, okay, XLAP natin, okay, your colonoscopy natin, lahat po sila ay part ng intraoperative phase. Now, until transported to RRN PACO. Proceed tayo. Your post-operative phase. Ano yung palatandaan natin dito? Kapag yung pasyente lumabas, paglabas niya doon sa OR suite or sa room niya kung saan siya inoperahan, paglabas doon, that's already your post-operative phase. Extends from the time the client is admitted doon sa recovery room until the patient is transported to the surgical unit, discharged from the hospital, and follow-up care. Again, your post-operative phase, okay, nag-uumpisa po ito kapag yung pasyente lumabas doon sa OR suite, okay, OR room, okay, sa kanyang inoperahan na area. Paglabas doon, papunta sa RR, papunta sa surgical unit, hanggang sa pag-uwi, hanggang sa follow-up care, post-operative phase. Again, naintindihan ba natin? Pre-operative phase, simula na nag-isip hanggang yung pasyente transfer sa OR, doon siya. Okay? Hindi pa siya nasa OR table. Kapag OR table, nakahiga na doon, nandun na siya sa OR, hanggang ipalabas na siya sa room na yon, intra-operative phase. Paglabas sa room, that's the start of your post-operative phase until follow-up care. Naintindihan ba? Okay, any questions so far? Wala? Okay, sige, proceed tayo. Okay, hold on for a second. Sige. Now, let's proceed on your 4 major types of your pathologic process requiring surgical intervention. Ano-ano yung mga rason natin bakit nagpapa-opera tayo? Hindi pwede na, ay sir, pupunta lang ako sa OR kasi gusto kong humiga sa OR table. Pwede ba yun? No. We have 4 classifications. We have 4 interventions. Isahin natin ito. The first one, obstruction. Impairment to the flow of vital fluids. Okay? Ibig sabihin, kapag hindi makapag-pass through yung ating dugo, okay, yung ating bile, okay, yung ating pag-ihi, yung CSF, merong tumor, merong obstruction, okay, merong bumara. Like for example, your cholelithiasis. Cholelithiasis merong what? Merong stones. So hindi makapag-pass through yung yung bile natin. Kaya impairment of the flow of vital fluids. Yan ay example ng ating obstruction. Next one, perforation. Perforation is the rupture of an organ. Yan po ay pumutok. Okay? Erosion, wearing off of a surface or a membrane. When we say tumor, that's abnormal new growth. Again, kapag tumor, abnormal new growth. Okay, sige, let's try it. Okay, sabihin nyo sa akin, okay, nurses, I want everyone to respond on me because I really wanted to make this class interactive. Tell me if it is obstruction. Remember the word pala, OPET. Remember the word OPET, obstruction, perforation, erosion, and tumor. Okay, sige, sabihin nyo sa akin, hydrocephalus, ano ito? Obstruction, perforation, erosion, or tumor? Sige. Ato, ano ito? I'll wait for your answers. Ano ito? Obstruction, perforation, erosion, or tumor? Ayan. Sige, nakikita ko na. Okay? From Ma'am Rowena, sabi ni Ma'am Rowena, obstruction. Okay. Same thing, yung sagot din ni Sir Jeremiah, ni Ma'am Vivi, okay, Renny Lane, okay, lahat, most of us answered obstruction. Obstruction nga ba? All right, very good. That's obstruction. Bakit? Impairment of the flow of your CSF, hydrocephalus. Lumaki yung ulo natin. Okay, sige. Proceed tayo. Next one, burn. 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 Ano yung burn? Okay. Hindi po ito tumor ha. Hindi po ito tumor. Obstruction po ito ng flow natin. Okay. Sige. Ano yung burn? Burn. Ano yung burn natin? Obstruction ba? Perforation ba? Erosion ba? Or tumor? Okay. Ano yung mga sagot natin? Ayan. Nakikita ko na yung mga sagot natin are all erosion. Very good. Tama ba? Ano yung mga sagot ng iba? Okay, erosion. Tama. Okay. Tama ba pala? Okay, very good. It's erosion. Tama tayong lahat. Okay, sige. Proceed tayo. BPH, benign prostatic hyperplasia. Question ko sa inyo, yung BPH is common ba sa babae? Yes or no? Common ba yung BPH sa babae? Yes or no? Common ba? Yung ating BPH, yung benign prostatic hyperplasia? Okay. Yung BPH po natin, hindi po ito common sa babae, kundi common po ito sa mga lalaki. Okay, very good. No, tama po yung sagot. Medyo delay lang tayo, pero opo, nakikita ko po yung mga sagot natin. Very good. Common po yung BPH natin sa mga lalaki. Now, question ko sa inyo, is BPH obstruction, perforation, erosion, or tumor? All right, very good. I can see answers na. Very good. Tama na yung mga sagot. Mukhang perfect natin yung exam natin ngayon. Parang mapapasa na natin yung Middle East exam. Kayang-kaya na ito. Ay, meron akong nakita na hindi siya same ng answer. Okay, ano ba talaga yung BPH? Yung BPH po is a tumor. Okay, meron pong abnormal growth doon sa prostate. Very good, very good. Prostate enlargement po yung ating BPH. Very good. Now, proceed tayo on your cholelithiasis. I have discussed this earlier. What is cholelithiasis? Okay, medyo delay lang tayo. Yun yung mga answers natin. No? Sige, yung cholelithiasis natin is the obstruction. Bakit? Obstruction of your bile. Okay, obstructed yung bile natin because of your stones. Okay. Intussusception. What is intussusception? Intussusception is what? Invagination or telescoping of your intestines. It is common among what? Pediatrics. It is common among what? Mga bata natin. Sa mga newborns and infants natin, yung ating intussusception. Now, intussusception is what? Obstruction, perforation ba, erosion, or tumor? Ano ba ito? Okay, very good. Obstruction. Very good. Obstruction yung ating intussusception. Now, lastly, ruptured aneurysm. What is ruptured aneurysm? Alam ko pumutok yung aneurysm eh. So ano ito? Obstruction ba? Perforation ba? Erosion ba? Or tumor? Ano yung sagot natin sa aneurysm? Ayun, paiba-iba tayo ng sagot ha. Parang nag-iba-iba yung sagot natin pagdating sa ruptured aneurysm ha. Anong ito? The correct answer here is perforation. Pumutok, rupture of an organ. Okay? Very good. Naintindihan na natin yung apat na classification, yung obstruction, perforation, erosion, at saka tumor. Wala tayong tanong doon, mag-proceed na tayo. Sige. Next one is your classification of your surgical procedure. Okay, first one is according to purpose. It should be diagnostic to establish the presence of disease condition. Like for example, meron ka dito, lumaki yung dede mo, meron tumor dito, lumaki yung dede. Of course, magpapabiopsy ka. The purpose of that surgery is diagnostic. Para malaman mo, benign ba ito or malignant. That's the first purpose of your surgery, diagnostic. The second one, exploratory, to determine the extent of disease condition, XLAP. Ano ito, sir? Ano yung exploratory? Like for example, we have a case before sa OR namin na yung pasyente is nagpunta sa ER and then complains of severe pain, okay, on the epigastric area. And then upon assessing, check namin, sabi ng kanyang records na nagkakaroon siya ng menstruation. Okay? Kasi productive age siya. Nagkakaroon siya ng menstruation. Kasi sa amin naman, wala naman yung problema. And then, hindi talaga namin ma-establish kung ano yung problema sa pasyente. So what we had is we do XLAP. Nag-undergo kami ng exploratory laparotomy. Upon the surgery, nakita namin yung pasyente is merong ectopic pregnancy. Nagbi-bleeding na yung pasyente, nagkakaroon ng dugo sa loob ng kanyang tiyan because of the ectopic pregnancy. Okay? So ibig sabihin, meron siyang problema, meron siyang ectopic pregnancy na hindi namin nakita. That's the purpose of your exploratory, to determine the extent of the disease condition. Again, to determine the extent of the disease condition. Another example, kapag tayo po ay nag-undergo ng appendectomy, simple appendectomy can be done for 30 minutes. Kayang-kaya yan, matapos sa 30 minutes. Pero kapag sinabi ko dyan, XLAP appendectomy. Ano yung ibig sabihin nun? Hahanapin nyo i-check ninyo yung extent ng disease ng appendectomy. Ng appendicitis, baka nag-rupture. Kailangan yung i-monitor yung mga nasa gilid or mga surrounding organs niya. Okay, sige, proceed tayo. The next one, curative. To treat the disease condition. Again, the first one is diagnostic, the second one is exploratory, the third one is curative, to treat the disease condition. There are three types of your curative. It could be ablative, constructive, and reconstructive. Again, ablative, constructive, and reconstructive. Ito yung ablative. Removal of an organ. Here's your tip, nurses. Huwag na nating pahirapan yung sarili natin. Kapag nakakita kayo ng ectomy na word, ablative po yun. Again, kapag nakakita po tayo ng word na ectomy, ablative po yun. Okay, sige, proceed tayo. Curative, constructive, curative, reconstructive. Ano ito? Ano yung difference nila? Kapag sinabi ko pong reconstructive, simula po nang ikaw ay pinanganak, meron kanyang problema. Like for example, meron kang problema sa iyong hard palate, palatoplasty. Okay? Palatoplasty, simula nung pagkabata mo, meron kang problema sa hard palate mo, ni-repair. That's the type of surgery na curative, constructive. Iyon. When we say reconstructive, repair of damaged organ. Like for example, binugbog ka. Pagbugbog sa'yo, okay? Pagbugbog sa'yo, nasira yung face mo. So, yung ginawa ninyo, ni-repair ninyo, that's example of your curative or reconstructive repair of damaged organ. Okay? And lastly po, palliative. Palliative is to relieve distressing signs and symptoms, not necessarily to cure the disease. This is already kapag tayo po ay nasa end stage ng life natin. Ibig sabihin, ililesen natin or ipopromote na lang natin yung comfort ng pasyente. Hindi na tayo nag-look forward, mag-cure natin yung sakit. Hindi na po yun. To relieve na lang po yung yung pain na na-experience ng pasyente natin. Again, recap natin. There are 4 purposes of your surgery: diagnostic, to establish the presence of disease; exploratory, to determine the extent of the disease; curative, to treat the disease itself; and palliative, to relieve the symptoms, to promote comfort, okay, to relieve pain, not to cure the disease. Clear ba tayo dito, nurses? Okay, sige, magta-try tayo. First one, pap smear. Okay, sabihan niyo sa akin kung ano ito yung purpose ng surgery. Diagnostic ba? Okay, curative ba to? Ano yung ating pap smear? Okay, very good. Nakakakita na ako ng tamang sagot. Ano yung sagot ng iba? Very good. O, diba? Nagre-retain na sa atin yung ating mga na-understand na topic yan. Very good. It's diagnostic. Diagnostic yan. Kasi malalaman natin kapag yung pasyente ba meron bang problema sa kanyang cervix or wala. Meron bang cancer meron bang malignant growth doon or wala. Very good. It's diagnostic. Now, tonsillectomy. I have discussed this earlier. Your ectomy. Ectomy. Ano po yun, sir? Baka nakalimutan ko na. What is your tonsillectomy? Sige, hintayin ko yung mga sagot ninyo. Medyo delay tayo, no? Okay lang yan as long as we are learning. Okay? Very good. Nakakakita na ako ng tamang sagot. Okay, curative. Tama. Curative. Specifically, ano ito? Very good. It's curative, ablative. Very good. Ayan, nalilern na natin yung technique natin dito. Kapag ectomy, that's ablative. Under your ablative is your curative. Very good. Next one, tonsillectomy, removal of your tonsils. Gastrectomy, removal of your stomach or part of stomach. So ano yung gastrectomy? Same answer ba? Curative, ablative ba or hindi? Ay, hindi sir. Hindi yan curative, ablative. Ano ba yung tamang sagot? Ano yung mga sagot natin? Ayan, nakakakita na ako ng maraming tamang sagot. Okay. Another tip pa pala, nurses, ha? If you are taking your NCLEX, if you're taking your Middle East exam, if you're taking your local board examination, pipiliin po natin yung specific answer. Never answer a broad answer. Like for example, sinagot ninyo curative. Remember, tama yung curative, pero tatlo yung classifications ng curative. So magiging mali yan. Pipili kayo ng specific. So yung tamang sagot, very good, curative, ablative. Okay? Very good tayo dito, nurses. Proceed tayo on your cheloplasty. What is your cheloplasty? Yung cheloplasty, ano ito? The repair of what? Your cleft lip and cleft, okay, cleft lip, repair of your cleft lip. Okay? Cleft lip, ano yung cleft lip pala? Yung cleft lip, simula ng pagkabata mo, yung parang meron ka ditong hiwa, yung sungi sa aming mga Bisaya, sungi yung tawag natin dito, pero in English, on your medical term is cleft lip. Ano yan? Yung cheloplasty natin. Ayan, very good. Specific tayo. All right, very good. That's what? Curative, constructive. Kasi ano nga yung definition natin ng constructive? Simula po ng pagkabata mo nandyan na yan. Okay, sige, next one. Perineopathy. Ano yan? Repair of your perineum. Ano po yan? Okay, nakakakita na ako ng tamang sagot. Sige. Ayan, very good. It's curative, reconstructive. Very good tayo dito. Kasi nga, hindi naman paglabas ng bata, wala naman siya problema sa kanyang perineum, ni-repair nyo lang. Yan yung palatandaan natin. It's curative, reconstructive. Very good. Proceed tayo. Last one, skin grafting. What is skin grafting? Ano yung skin grafting natin? All right. I can see right answers na. Tama na yung mga sagot natin. Very good. It's curative reconstructive. Kasi nga, baka meron ka lang burn. So, hindi mo naman siya nakuha nung simula ng pagkabata mo. Okay? Nasira lang yung skin integrity mo. So, kailangan nating i-repair. It's curative reconstructive. Very good, nurses. Okay? Sige. Very good tayo dito. Proceed tayo. Now, next one. Kanina, purpose, let's proceed on your urgency. Yung urgency natin, iba po ito. Okay, parang triage din pala. Triage din siya, pero iba po yung ating military triage at saka hospital triage. Itong triage na ito po yung classifications natin in the OR. Again, kapag tayo po ay naka-enroll sa ating IPASS, meron po tayong tinatawag na emergency nursing. Tinuturo ko po din ito. So yung emergency nursing natin, we have two types of your triage, your military triage and your what? Hospital triage. Yung military triage, ginagamit po natin ito sa field, sa labas ng hospital. Kapag nasa hospital naman po tayo, ito ay tinatawag na hospital triage. So ibig sabihin kapag kayo ay naka-admit sa hospital, huwag kayong magalit kapag ipapahuli kayo kasi yung problema nyo, dysmenorrhea. Kasi uunahin namin yung pasyenteng what? Naghihingalo. Uunahin namin yung walang hininga. Naintindihan ba? Huwag kayong magalit. Okay? Kasi meron tayong sinusunod na triage na protocol. Okay? Sige. Proceed tayo. Urgency. Urgency. Okay. Emergent, urgent, required, elective, and optional. These are the 5 classifications or 5 types of urgency sa OR natin. First one, emergent. Patient requires immediate attention. Okay? Immediate attention, life-threatening condition without delay. Again, hindi pwede yung pasyente ma-delay dito kasi kapag hindi mo siya inasikaso or hindi mo siya inuna, baka magkakaroon ng problema. Fatal yung pasyente. Ano yung mga examples natin dito? Severe bleeding. Ano pa? Gunshot. Ano pa? Stab wounds, fractured skull. Ayan. Yan yung mga classifications natin hindi pwedeng ma-delay. Next one. Urgent at saka imperative. Nurses, here's your tip. Huwag po tayo ma-confuse with the word emergent at saka urgent. Kasi yan yung confusion ng students parate. Urgent at saka emergent. Ano yung difference nila? Kapag pumunta ka sa emergency room, uunahin ka. Emergent. So, ibig sabihin, uunahin mo yung emergent. Importante yung emergent kesa sa urgent. Ipapahuli yung urgent natin. Okay. Urgent patient requires prompt attention within 24 to 48 hours. Again, within 24 to 48 hours. Ano yung mga examples natin ng mga urgent cases? Like for example, your kidney, your rectal stones, your cholelithiasis. Kailangan operahan yung pasyente dito. Okay, next one. Required. Patient needs to have surgery. Plans within weeks or months. Ibig sabihin, kahit hindi naman siya ganun, hindi naman siya kailangan ngayon, pero kailangan siyang operahan in few days or in few weeks. Like for example, your cataract, your thyroid disorder, meron kang thyroid storm, ano pa, you have impacted tooth, okay? Meron kang wisdom tooth, okay? Na impacted. Hindi siya ganun ka-fatal para sa atin ngayon, pero kailangan siya operahan within few months. Alright? Next one, elective. Patient should have surgery. Failure not to have surgery, not catastrophic. Ibig sabihin, hindi po siya makakapag-cause ng detrimental effect sa pasyente natin. Wala siyang mangyayari na ganun kalala or let me say fatal sa pasyente natin. Like for example, repair of scar, vaginal repair, yung mga acne scar natin, okay, yung mga keloid natin. Okay, hindi siya ganun catastrophic or fatal sa patients natin. And of course, lastly, lahat po ng cosmetic surgery, your rhinoplasty, okay, your boot or your boobs enhancement, yan, yung sa mga puwet natin, okay, yung sa mga bakla, okay, sa mga gays natin pala, sorry, sa mga transgenders, sorry for the term, sa mga transgenders natin na gustong magpapa-opera, yan po ay optional surgery. Personal, preference po yan. Okay, sige, proceed tayo. Okay, now let's proceed to according to degree of risk. We have your major at saka minor surgery. Major and minor surgery. Your major surgery is high risk, greater risk for infection, extensive, prolonged, large amount of blood loss, and vital organ may be handled. Again, yung major surgery natin, ito yung palatandaan natin, prolonged, more than 2 hours. Minor surgery natin, generally not prolonged, leads to few serious complications and involve less risk. Ito yung mindset ko. Ito ako magsagot ng exam. Kapag major surgery, it is expected more than 1 liter ang kanyang blood loss. Large amount of blood loss. Ganyan ako mag-isip. Kapag minor, less than 1 liter. Okay? Kapag merong vital organs na involved major surgery, pero kapag hindi naman siya ganun kalala, yung kanyang surgery, it's minor. Sige, sabihin niya sa akin, major or minor surgery. Okay, sige. Appendectomy, major, minor. Nurses, appendectomy, is it a major or a minor case? Appendectomy. Oh, ayun. No, okay. Okay, ito yung classification natin. Your appendectomy is a minor case. Again, clarify natin. Very good. Meron nakakuha ng minor. Yung ating appendectomy is a minor case. Hindi po siya major case. Bakit? Yung minor natin dito, hindi more than 1 liter yung blood loss natin sa appendectomy. Within 30 minutes, kaya siyang operahan. Okay? Minor surgery. Sige. Okay lang yan, nagkamali at least ha. Okay lang yan, nagkamali at least we learn from our mistakes. Sige, proceed tayo. Next one. Normal, spontaneous, vaginal delivery. Normal, major, minor. Your NSVD, major, minor. Nakikita ba yung screen ko? Nasa degree of risk ba ako? Bakit sa phone ko hindi nag-move yung screen? Okay, sige. Okay, nasa major risk. Thank you. At nandito tayo sa degree of risk. Sige. Yung ating normal, spontaneous, vaginal delivery, minor, major. Ayan, bakit hindi? Ayan, bakit iba-iba yung mga sagot ninyo? Hindi kayo same answers. Okay. Okay? Normal, spontaneous vaginal delivery, ito po yung pag-deliver ng mother ng kanyang bata, ng kanyang anak. Okay? This is considered minor surgery. Bakit? Magkano ba ang expected blood loss kapag NSVD? Nurses, magkano yung expected blood loss natin kapag NSVD? Sige, mag-isip muna tayo. Bakit iba yung mga answers natin? Ayan, very good. May nakakuha ng tamang sagot. Sabi ni Miss Jeje Gutierrez Ambon, minor lang po kasi konti ng blood loss. CS yung major. Very good. You got it correct. Very good. Yung ating NSVD is a minor case kasi ang expected blood loss natin is just only 500 ml. Sabi ko nga, basta less than 1 liter, it's minor. Basta more than 1 liter, it's major surgery. Yung expected blood loss natin sa cesarean section is 1 liter, 1,000 ml. Kaya considered siya as a major surgery kapag NSVD, minor surgery. Yes, very good. Yan, tama. Less than 1 liter or half a quart or 500 ml. Yes, very good. It's a minor case. Sige. Another one. Kapag sinabi ko pong ano pa ba? Cholecystectomy. Ayan, cholecystectomy. Cholecystectomy. Ano yung cholecystectomy natin? Minor ba or major? Bakit pa iba-iba tayo ng sagot? Sige, kailangan pa talaga natin ng maraming practice test. Dito sa IPASS natin, sa IPASS Academy, we have a lot of practice tests. Hindi po tayo nagkokopya ng ibang exams, ano? Hindi po tayo ganito yon. Dito sa amin, ginagawa talaga natin yung exams para ma-determine natin yung quality of questions. Okay? Yan yung kinaiba ng ating IPASS Academy. Yes, yung ating cholecystectomy is major, not a minor case. Bakit? Cholecystectomy. Cystectomy. Removal of what? Cholecystectomy. Removal of your gallbladder. Okay? Yan po ay is a major case. Yan po ay major case. Hindi po yan minor. Bakit? Yan po ay extensive. Yan po ay prolonged. And of course, vital organs are handled. Sige, another one. Kapag sinabi ko pong incision and drainage. Yan. Incision and drainage. Very good. Ayan, nakuha na nila. Very good. Incision and drainage is a minor case. Very good. Sige, another one. Another one kasi nako-confuse kayo. Amputation of the big toe. Again, amputation of the big toe. Major or minor? Ayun, nako-confuse na naman kayo ulit. Amputation of the big toe. Very good. Tama, minor yung incision and drainage. Pero yung amputation of the big toe. Very good. It is a minor case. Bakit? Hindi siya ganun kalala yung kanyang blood loss. Pero pag sinabi ni Sir, amputation of the right thigh or right leg, o kaya na lang, amputation of the right leg, minor or major? All right, very good. It is a major case. Again, amputation of the right leg is a major case kasi nga expected yung mas maraming dugo yung mawawala. Tama, very good. Sige, proceed tayo. Another one is your same-day surgery, outpatient surgery, or ambulation surgery. Ano ito? Ano yung advantages ng ating same-day surgery? Reduces the length of the hospital stay, cuts cost, reduces stress for the patient, less incidence of hospital-acquired infection, and less time lost from work by the patient, minimal disruption on the patient's activity and family life. Ito yung advantage is that hindi expensive, pwede siyang mag-perform, pwede siyang bumalik. Okay? Pwede siyang bumalik the next day sa kanyang work. Walang may nagbago sa kanyang activities of daily living. Very good tayo dito. Okay. Give me examples of your same-day surgery. Sige, give me examples of your same-day surgery. Very good. Ayan, nakakakita ako ng tamang sagot. Very good. Biopsy, cataract, circumcision. Yes, those are correct. Ibig sabihin po nito, kahit paglabas ng pasyente, wala siyang ganon kalalang, hindi na kailangan ng, yes, kailangan natin ng follow-up care, pero hindi siya ganon na kailangan talaga ng intensive na pag-care sa pasyente. Pwede siyang lumabas. Very good. Okay, sige. Ito yung mga examples natin of your ambulatory surgery: teeth extraction, circumcision, vasectomy, cyst removal, and of course your tubal ligation. Okay, very good. Pero ano yung disadvantage pala ng ating same-day surgery. Less time to assess the patient and perform pre-op teaching. Okay? Remember, di ba sinabi ko sa inyo, preoperative phase, intraoperative phase, and postoperative phase. Pagdating po dito, kapag naka-enroll po tayo sa IPASS, okay, on your examinations, sa review natin sa IPASS Academy, ituturo po namin sa inyo yung mga phases, yung 3 phases, saan papasok yung anesthesia natin, okay, saan papasok yung ating mga informed consent. I-discuss natin yan dig deeper kapag tayo po ay nasa intensive coaching na tayo. Okay, sige. Ano yung advantage nito? Pre-op teaching. Question ko sa inyo, is pre-op teaching done on what phase? Pre, intra, or post-operative phase? Pre-op teaching is done, or pre-health education, pre-op teaching, okay, or pre-op education. Kailan ito nadadaan? Intra, post, or pre-operative phase? All right, very good. On your pre-operative phase. Question ko sa inyo, when is the best time to perform your pre-op teaching? Sabi nyo sa akin, pre-operative, sir. Sir, okay. Kailan ba? 1 week before, 3 days before, night before, 30 minutes before, 3 hours before. When is the best time to perform your health education, your pre-op teaching? Very good. Ano yung mga sagot ng iba? Yan, very good. Very good. Okay. Night before or day before the surgery is the correct answer. Hindi po pwede from the time the patient contemplated and sought consult. No. The best time to do your pre-op teaching, night before the surgery. Bakit? Included ano yung inclusion? Ano yung nakalagay doon sa ating pre-op teaching? Ituturo natin yan so on your final coaching, yung ating mga turning, incentive spirometer, deep breathing exercises, no? Yung ating mga consent, papasok yan sa pre-operative teaching. So kailangan natin yan i-perform night before the surgery or day before the surgery. Kasi remember kasi kapag 3 days before or 1 week before ka nag-health education or even from the time you contemplate, okay, nag-isip ka na mag-surgery, makakalimutan yan ng pasyente. Ay, nakalimutan ko ano ngayong gagawin ko after the surgery. Makakalimutan niya yan. Pero kapag yung pasyente naman is 30 minutes or 1 hour before the surgery, hindi yan makakapag-focus sa iyo. Bakit? Yung kanyang attention ay nasan? Yung kanyang attention ay magpapa-opera na ako. In few minutes, I will be in the OR na. Yung kaba, yung anxiety is increasing. Another pa pala, the purpose of your pre-op teaching is what? To determine kapag meron po tayong anxiety, fear of the unknown. That's why it's very important to perform your health education day before or night before para malaman natin, ma-assess natin kung ano yung nafe-feel ng pasyente. Kapag nagsabi siya, nurse, kinakabahan ako. Bakit ka kinakabahan, ma'am? Hindi ko alam bakit ako kinakabahan. Health education is the best answer there. Okay, sige, proceed tayo. Yes, anxious na siya kapag 30 minutes or 45 or an hour before the surgery. Less time to establish rapport and of course, less opportunity to assess for late post-operative complications. Okay, very good. Sino-sino yung mga surgical risk? Again, sino-sino dito yung mga surgical risk? First one, obesity. Kapag masyado po tayong mataba, you are at risk. Okay? Poor nutrition. We know ano nga yung purpose ng protein natin? Muscle and tissue repair. So, ibig sabihin, kapag poor yung nutrition natin, wala tayong proper intake of your protein, hindi maganda yung healing ng ating sugat. Okay? Next one, fluid and electrolyte imbalances. Your age, the more the younger and the more the older the patient. Kapag elderly, most especially kapag masyadong matanda yung pasyente, at risk yung pasyente dito. Presence of cardiovascular, diabetes mellitus, and respiratory disease. That's why before ka po mag-undergo ng surgery, you must have your what? Your anong consent ito? Anong form pala? Anong form na nire-require ng mga doctor before ka mag-undergo ng surgery? Kapag meron kang problema sa puso or sa lungs mo. Yes, tama. Informed consent. Very good. May nakakuha po 'yon. IM o sa iba IM clearance daw. Sa iba, okay, very good. Informed consent. Best, tama din po yan. Pero yung hinahanap po na sagot po is CP clearance. Your cardio pulmonary clearance. Okay, medical clearance, masyado po itong broad. Yung hinahanap natin is specific. Your CP clearance. Very good. Tama yung mga sagot natin. Your cardio pulmonary clearance. It's because kailangan muna natin ma-clear. Kailangan muna natin ma-clear sa ating internist. It may be in cardio or pulmo na okay ka mag-undergo ng surgery. You are free. You are good to go for surgery. Kasi kapag meron ka pong problema, hindi ka po muna mag-undergo ng surgery. Kailangan po munang gamutin yung problema yon. Another one, diabetes mellitus. Diba? Kapag masyadong mataas, okay, naka-spike up yung sugar level ng pasyente natin. Diba kino-correct muna na ng endocrinologist before siya mag-undergo ng surgery? Bakit? Kailangan muna natin i-correct yung kanyang blood sugar para maganda ang kanyang healing. Kasi kapag hindi maganda ang kanyang blood sugar, mahihirapan tayo mag-heal. Kasi nga, delay yung ating wound healing. Very good. Very good. High-risk consent. Okay, very good. High-risk consent. Tama po yan. Okay, proceed tayo. Concurrent or prior pharmacotherapy. Kapag yung pasyente merong maintenance, yan, sa mga matatanda, yan. Kapag yung pasyente merong let me say, merong maintenance for life, okay, at risk po yung pasyente natin dito. Okay, other factors like, for example, nature of the condition, location of the condition, magnitude or urgency of the surgery, mental attitude of the patient, and of course, caliber of the healthcare team. Kapag yung pasyente, okay, expert siya dito, marami siyang pinag-aralan, okay, maraming degree or diploma na receive yung doctor, mas maganda yon. High caliber yung doctor natin. So kapag hindi ko naman ginalahat, no? Pero kapag tayo ay mga, for example, we are fresh graduate, of course, di ba sabi ni Lydia Hall doon sa clinical proficiency ng mga nurses, di ba kapag tayo ay fresh graduate, ano ito? Advanced beginner. Same thing applies kapag tayo ay doctor. Kapag bago po tayo, of course, hindi pa natin master lahat. The more matanda ka, the more nga matagal ka na sa industriya, or let me say, matagal ka na sa field, mas magaling ka na. Okay? Lahat tayo ay nagsisimula sa pagiging novice. Yan yung sabi ni Lydia Hall. Novice, advanced beginner, competent, proficient, and of course, lastly, you are already an expert. Okay? That's coined by Lydia Hall. Sige, proceed tayo. Informed consent. Last topic tayo, informed consent. Kailangan natin ng informed consent kasi kanina ko pa dito nakikita yung consent. Question, who is responsible for obtaining the informed consent? Sino yung responsible ng informed consent natin? Ayan, very good. Ang gagaling ng mga... Oh, ayan, may nakita ako nagkamali. Sige. Ano ba? Doctor ba or nurses? Ano yung mga sagot natin? Ayan. Sige. Let me clarify it to you. Remember, nurses, responsible for obtaining the informed consent is you are not the nurse. The doctor is responsible of getting or obtaining the informed consent. Hindi yung mga nurses. Bakit? Ano yung purpose ng informed consent? The purpose of this is example of your informed consent. Okay? Meron yan, name ng pasyente, sino yung doctor, ano yung procedure, signature ng pasyente, at ikaw yung nurse ang witness. Okay? This is an example of your informed consent. Again, ano yung purpose ng ating informed consent? To ensure that the client understand the nature of the treatment, including the potential complication and disfigurement explained by the attending medical doctor. Ibig sabihin, sino yung mag-e-explain ng lahat ng procedure? Nurses ba or doctor? Doctor yung responsible nun. So, ibig sabihin, yung doctor yung magkukuha ng informed consent. Siya yung mag-o-obtain. Remember, question ko sa inyo, ito na lang nurses ha. Sa hospital, pwede bang mag-disclose yung nurse ng information sa pasyente na, ay, mababa yung hemoglobin level mo, mababa yung CBC mo, pwede ba yun? Yes or no? Hindi yun pwede. Okay? Kasi nga, nurse ka lang, huwag kang pabibo. Okay? Nurse ka, dapat nandito tayo sa ating scope of nursing practice. Tayo mga nurses, yung nag-o-obtain ng info. Listen carefully. Okay, may nakita ako, hindi po. Tayo yung doctor yung nag-o-obtain ng informed consent. Sila po yung nagpapapirma. Again, sila po yung nagpapapirma na naintindihan nila yung case nila na gagawin. Alam nila na, for example, i-amputate sila, puputulin yung paa. And then hindi pala nila alam kasi nurse lang yung nag-explain. Kailangan doctor yung mag-explain at saka doctor yung kumuha ng signature. Pero ano yung practice sa Pilipinas? Okay? Guilty din ako dito. Ang practice sa Pilipinas, nurses yung kumukuha ng informed consent. It's a big no-no kasi kapag kayo po ay nag-take ng examination, it must be ideal. Kung ano yung nakasaad sa libro, kailangan objective tayo. Okay? Objective tayo dito ha. Hindi pwede kung ano yung nakikita natin sa practice, yan yung susundin. Okay? Hindi ko linalakat pero most of the doctors, ganun. Okay, kunin mo yung informed consent, magpaparma ka dun. Doc, marami akong ginagawa. Okay, just joking, no? Pero yes, nurses po are just responsible for securing the informed consent. Ano, sir, yung ibig sabihin, naguguluhan ako? Obtain, ibig sabihin, yung magpapapirma or yung kukuha ng informed consent, yung doctor. Nurses are just only the witness and tayo po yung magsisecure. Ibig sabihin po ng sisecure, after napirmahan ng napirmahan ng pasyente at saka ng doctor, ikaw yung magsisecure na nasa loob siya ng chart. Kasi kapag endorsement na, i-endorse mo siya sa nurse doon sa OR, ikaw yung mag-e-endorse na, ay nurse, ito na pala yung informed consent. Kasi kapag wala yung informed consent mo, deferred yung case natin. Hindi yan magpe-perform, hindi yan magpa-function. Pero in reality, sino yung gumagawa? Kasi tayong mga nurses, masyado tayong pabibo. Sige doc, ako nang bahala dyan. Ako na yung kukuha ng informed consent. Nahihirapan na tayo, pero sige lang, push lang tayo ng push. But remember, hindi yan pwede sa examination. Dapat doctor talaga yung kumuha ng informed consent. Okay? Ayan, tumatawa kayo pero guilty tayong lahat kasi ako din nung nasa ward ako yung kumukuha ng informed consent. Sige, proceed tayo. Very good. Secure the completeness of the consent. Yan. Ituturo natin yan, ididig deeper natin sa ating online review here on your IPASS. Okay? Ididig deeper natin yan. Ano ba yung mga dapat na sa informed consent? Tama, very good. Secure natin ang completeness of the consent. Very good. To indicate the client's decision must made without pressure. You are the witness here. You are the client advocate. Ano yung ibig sabihin, sir, ng client advocate? Hindi ko yun naintindihan. Kapag sinabi ko pong client advocate, it simply means that you stand beyond the patient. Ibig sabihin, kapag hindi naintindihan ng pasyente, ikaw yung kusang sasabi, Doc, hindi naintindihan ng pasyente, explain mo ulit. Question ko sa inyo, kapag sinabi ng pasyente night before pre-op teaching, night before or day before the surgery, sabi ng pasyente, nurse, ano nga yung gagawin sa akin bukas? Pwede mo nga sabihin sa akin kung ano yun? Okay, kapag ganun yung sinabi ng pasyente, ano yung gagawin ng nurse? Okay na yan. Okay, maggaganda ka. Okay, maghihilom yung sugat mo bukas. Okay, ano yung gagawin ng nurse? Proceed pa din ba natin yung procedure natin dito? Ano yung gagawin natin kapag very good? Very good, Miss Ma'am Lona. Okay, very good, Miss Rowena. Tama po yung mga sagot natin. Call the doctor, sabihin sa doctor natin na, Doc, I am really sorry. Pero yung pasyente po hindi po naintindihan yung case na gagawin sa kanya. Pwede po bang bumalik kayo dito sa hospital? O, di ba nag-demand ka pa na nurse? Pero yan yung proper ha? Yan yung proper kasi natatakot lang tayo sa mga doctors natin. Pero yan yung proper. Okay? Doc, inform ko lang Doc na yung pasyente po hindi po naintindihan kung ano yung gagawin nating case bukas sa kanya. Pwede po ba kayong bumalik dito para ma-explain ng mabuti yung case ng pasyente? Kasi po Doc, as a nurse, it is beyond the scope of practice ng nurses na mag-explain ng procedure sa pasyente. It is the responsibility, Doc, to explain it further sa pasyente natin. Oh, ayan, nagmamagaling ka pa sa doctor natin, for sure, magagalit yung doctor mo. Just joking, okay? But, yan po yung proper and ideal natin. Okay? Next one, to protect the client against unauthorized procedure. We should be what? Witness here. To protect the surgeon and the hospital against legal action by the client who claims that an authorized procedure was performed. Yan. Yan din po yung purpose ng consent natin. Okay, sige. Circumstances requiring consent. Ano-ano yung may mga consent? Surgical procedure where scalpel, scissor, suture, hemostats, coag are used. Okay, yung coag po, yan po yung parang sinusunog natin. Yan po yung parang, let me say, na nagsasamgyupsal, no? Kapag tayo ay nasa OR, smell baboy yan, okay? Parang nagpiprito tayo ng nagsasamgyup tayo kasi yung baho na ng sinusunog natin na taba. Okay? Sige. Entrance into the body cavity, basta may pinasok, kailangan yan ng informed consent. Radiologic procedures, particularly if a contrast dye material is required. Kapag meron po tayong dye dito, kailangan yan ng informed consent. Okay, side note lang ito, okay, hindi ito, okay, part din ito ng OR, pero question ko sa inyo, ano yung first thing na ginagawa ng nurses kapag meron pong contrast dye? Ano yung chine-check natin dito? Sige, ano yung ginagawa natin ng mga nurses kapag yung pasyente is for contrast dye? Very good. Nakakita ako ng allergy. But specifically, ano talaga yung hinahanap natin? Specific answer yung gusto ko pong makita. Yes, tama po yung mga sagot ninyo, allergy. But specifically, ano po yun? Check creatine level, pwede, yes, pwede din po siya. Pero meron talaga tayong isang. Okay, it is a must. Okay, parati talaga siyang kahit, okay, ito ha, kapag sinabi ko pong it is a must, kasi kahit hindi po sinabi ng doktor, kailangan natin gawin. Yung creatinine level natin, yes, tama din po yan, pero it requires doctor's prescription. Ito po ay isang dependent nursing intervention. Yung tinatanong ko po is a nursing independent action wherein na hindi kailangan ng doctor's order, pero ginagawa natin. Ano ito? Very good. Check on iodine. Again, hindi po hindi po ito yung ating iron. Kailangan natin i-check yung allergy. Sabihin natin, patient, meron ka bang allergy sa seafood? Sabi ng pasyente, oo, meron akong allergy sa seafood. O bakit? Ano yung meron sa seafood? Iodine. Yan yung chine-check natin kapag yung pasyente merong allergy sa iodine. Okay? That's the correct answer. Okay, allergy to dye. Very good. Allergy to seafood. Yes, very good. Okay. General anesthesia, local infiltration, and general black. Your anesthesia will be discussed further and first more detailed sa ating intensive review here on your IPASS. Okay, sige. Proceed tayo. Ano-ano ang mga essential elements on your informed consent? Ano-ano yung nasa loob ng informed consent? Diagnosis and explanation of the condition. Kailangan malaman ng pasyente, okay, ito yung i-perform sa akin. Alright, amputation, above the knee amputation, below the knee amputation. Kasi kapag nakalagay doon na below the knee amputation, and then inamputate ni doctor na above the knee, ay mali yung procedure na dinana ni doctor. Okay, so kailangan alam ng pasyente kung ano yung gagawin sa kanya. A fair explanation of the procedure to be done and use and the consequences. Kailangan isabihin natin, okay, pag inamputate po ikaw, hindi na po mababalik yung paa ninyo, magkakaroon po kayo ng magkakaroon po kayo ng crutches for life. Okay? Ituturo din po natin yung mga crutches natin, walker natin on your musculoskeletal system. A descriptive of alternative treatment of procedure. Alternative treatment. Like for example, meron kang tumor, ayaw mo magpa-chemotherapy. Ayaw mo magpa-opera pala, ayaw mo ipakuha yung tumor, pwede yung chemotherapy. Again, ibibigay ng doctor lahat ng treatment sa'yo. Okay? A description of the benefits to be expected and of course, the prognosis if recommended care procedure is refused. Ibig sabihin, kailangan malaman ng pasyente, Doc, kapag pinerform ko ba ito, maganda ba yung prognosis? Mabubuhay pa ba ako ng matagal? Okay? Or mamamatay na ako after 3 months? Okay? Kailangan yan isabihin ng doctor sa iyo. Okay? Requisites of validity of informed consent, written permission, adult sign obtained before the sedation. Ibig sabihin, pwede po magpirma yung pasyente as long as conscious siya and of course before sedation. Next one, for minors, kailangan merong parents na nandun. Kailangan merong parents or merong guardian na mag-allow sa kanya na mag-perform ng surgery. And of course, note, For married emancipated minor, parental consent is not needed anymore. Spouse is accepted. Just for instance ha, yung pasyente natin is 16 years old. Teenage mom. Yan, teenage mom natin. Yung teenage mom natin, and then okay ba yung teenage mom natin na magbigay ng consent sa kanyang anak na newborn, or kailangan talaga yung lola? Kasi yung lola ay alam ng lola na hindi pa 18 years old ang kanyang bata. Question, pwede ba magbigay ng consent yung teenage mom? Yes or no? Pwede ba? Very good. Yes. Tama po kayo. Yan po ang example ng emancipated minor. Ibig sabihin mo, kaya niyang mabuhay or kaya na mag-decide on her own. Another example is that, di ba, sa atin sa Pilipinas, meron talaga tayo na kahit 21 years old ka na or kahit 25 years old ka na talaga, kailangan mo mag-ask ng lisensya sa iyong parents, di ba? May mga strict parents talaga. Okay? Pero remember this, kapag pumunta po kayo ng US, pumunta po kayo ng ibang bansa, kapag yung bata ay gusto ng humiwalay or mag-separate sa kanyang parents, even though 16 years old pa lang siya, pwede na siya magbigay ng consent. Kasi yan ay considered nating emancipated minor. Very good. Proceed tayo. Okay. For mentally ill and unconscious patient, consent must be taken from the patient's or legal guardian. Yan. Mentally ill. Question ka sa inyo, pwede pa rin ba? Nurses, pwede pa rin bang mag-sign pwede pa rin bang magbigay ng consent yung mentally ill na tao? Yes or no? Allowed pa din ba mag-sign ng documents? Yes or no? Ano yung mga sagot natin dito? Ayan. Masyado tayo na-confused dito Sige. Most of you answered no. Okay, no. Okay. Listen carefully, nurses Kapag yung pasyente ay mentally ill, okay, mentally ill yung tao, hindi siya pwedeng magbigay ng consent. But kapag yung tao ay nasa lucid interval, what is the meaning of lucid interval? Ibig sabihin, bumalik siya sa kanyang sariling mundo. Bumalik siya sa kanyang pag-iisip. Ibig sabihin, in contact siya with reality. Diba, a mentally ill individual is not in contact with reality. Hindi niya alam if ano yung pinaggagawa niya. Okay? Pero yung pasyente, kapag nasa lucid interval, alam niya kung ano yung ginagawa niya, conscious siya sa surrounding niya, pwede yung pasyente magbigay ng informed consent. Again, clear ko okay? Okay, lahat kayo know yung answer. Again, clarify ko po ito Clarify ko po ito. Kapag yung pasyente ay insane, hindi siya mentally unstable, okay? Hindi mentally ill talaga. Hindi siya pwedeng bumigay ng informed consent. Tama kayo doon. But kapag yung pasyente ay nasa lucid interval, tama po kayo. Yes, tama po, Ma'am Audrey. Ayan, si Ma'am Audrey po. Yes, tama po. Yes, during lucid interval. Ma'am Audrey Delgado is one of our passers here in our Middle East Nursing Review. So congratulations, Ma'am. Recent lang po siya nakapasa. So shout out to you, Ma'am, and congrats. Ayan. Ayan, sabi din ni Ma'am Pam Villegas Riveta, yes, kapag nasa lucid interval state siya. Yes, again, pwede pong magbigay ng consent yung isang insane na tao kapag nasa lucid interval. Okay, naintindihan ba? Okay, sige. That concludes our discussion today. So, ayun, shout out. I'm so happy kasi nakita ko yung name ni Ma'am Audrey. Si Ma'am Audrey kasi is one of our passers sa ating Middle East review. Okay, so yan lang. I hope that I can see you again next week, no? So, congratulations everyone. Okay, advance congrats sa mga magte-take ng examinations natin internationally. And of course, I just want to promote here that IPASS is offering what? Review classes for your NCLEX and Middle East examinations. So back to you, ma'am. Hi, Ma'am Rachel. Bigay ko na po sa inyo yung floor.
Thank you very much, Sir Christian. And nothing from me. Wala nang akong, Sir Christian, additional na sasabihin. Thank you very much, everyone, and God bless po sa inyong lahat. Bye, everyone. See you next time on our next discussions. Thank you.